Good afternoon, Dr. Girish Tyagi.
Good afternoon.
Dr. Girish Tyagi is Delhi Medical Association's president. And sir, we have few questions. This time, due to the cold rips, cough syrup, so many questions have arisen about the safety of children. So we wanted to talk to you as a DMA president. What do you think about all this scenario being going on? So my first question is, what are your thoughts on the recent controversy surrounding the cold rip cough syrup, and how do you think the medical community can work together to prevent similar incident in the future?
Medical, as far as this present scenario is concerned, in which the cold syrup is involved,
Right.
involved,
Right.
the medical community should see to it that, first of all, about the efficacy of that drug, whether the syrup or the any medicine they are prescribing should not have a substance which is being prohibited for that matter. Because regarding this cold syrup, one uh, of course, when it was banned, before that was a diethyl glycol, which should be at the pointed level, was multiple times higher than it because of that child died. So, medical community, the role of medical community is to ensure that whatever they are prescribing should be a legitimate prescription.
As president of Delhi Medical Association, what steps do you plan to take to address concern about patient safety and medication quality?
Because as we the doctors, first priority is the patient safety.
Right.
And amongst the patient safety is the medication safety, which involves the drugs, because that adverse reactions or multiple things are being there because of these medication. So medication safety is very important thing. First of all, what in the recent also there was one incident in which the high court of one state has taken action against the doctors because of these handwriting was not proper,
Okay.
and chemist has given
Different
some
medicine.
different medicine, and because of that
The misconception happened.
reaction occurred to
Right.
that child. So first is that your handwriting should be proper.
Doctor's handwriting, which is
Doctor
a
handwriting
major
should be
thing nowadays. Yeah.
proper, so that the chemist
Able to understand the language.
understand the language, and they should not be misplaced of the drug for that matter.
Right. Right. So, how do you think the government and medical community can collaborate to strengthen pharmacovigilance and ensure the safe use of medications? Pharmacovigilance.
Yeah. In this, they say government and the medical communities. First of all, we should ensure that chemist prescribed only on the valid prescription,
Right.
because we have seen, at least in Delhi, and whosoever can go to the chemist, they ask for the medicine, chemist give the medicine. So, and once some complication occur, then he will go to the doctor also. So it will be a loss of finances as well as that manpower and the. So government should ensure that the chemist should give the medicine only on the valid prescription. You can go to the Bhagirath place, which I am telling the name of the Bhagirath place because it's a wholesale market,
Right.
in which the number of quacks go to that market, take the medicine in bulk,
Right.
any medicine, without without the bill. So chemist should give the medicine on the prescription, and bill should be there. They should give to the bill to that doctor.
Right. Right. Okay. On the this cold rip cough syrup issue, the cold rip cough syrup controversy has raised concern about the quality of medication in India. What measures do you think can be taken to ensure the quality and safety of medication in the country?
The role of drug controller is very much required there, because once that any medicine being manufactured, there should be proper infrastructure, proper say, suppose the medicine is being transported to one place to another place. So cold chain or whatever the temperatures being required should be there. And we have seen that the medicines are being manufactured in remote places in a single room, in which the medicine are being manufactured and then transported. And sometimes in these the spurious drugs also come into force.
Okay.
So government role and particularly the drug controller role is very much important. Along with that, the government of India, which give a certificate to for a particular drug,
Right.
should be maintained, should be there, that so that some banned medicines are not in the market.
Right. Right. There have been reports of pediatricians being arrested in concern with the death of children who consume the contaminated cough syrup. Do you think this is a fair response, or should the focus be on the manufacturers and regulatory bodies instead?
Arresting a doctor who has just prescribed the medicine, he has not manufactured the medicine, he has not made the medicine, and because it is a job of the drug controller or the government agency to see to it that the, the these medicines should contain that specified composition,
Right.
specified whatever their specification,
Right.
and because he's pediatrician or a doctor just prescribing a medicine, he's
Right.
not manufacturing. So arresting
Right.
a doctor is just a non-thinkable thing,
Yeah.
which government should see to it that in future at least such kind of incidents they should catch hold of chemist or the medicine where the
This is
medicine
manufactured.
being manufactured. Primarily, the manufacturer role is there.
Right. Absolutely.
Yeah.
Okay. What guidance would you offer to parents and caregivers about the safe use of cough syrup and other medications for children?
First of all, if they have children, they should go to a pediatrician
Right.
or to a valid doctor. Before going to the doctor, just see to it that it is he has a valid qualification and is registered with the particular state medical council in which this is person. So, and there is they can identify themselves because in that protocol, the doctor has to display the certificates in his clinic issued by the state medical council in which the photograph of that doctor is also there,
Right.
and QR code is sometime most of the time it is QR code is there. So QR code, just scanning that QR
Authenticate the
code
doctor.
that authenticate doctor. If they are going to the qualified doctor registered with the state medical council, chances of any mishappening quietly reduces much.
But like in this example, in Madhya Pradesh, Chindwara, where this incident happened, it's a small village. You know, the way you told me that so many things are not available there. So how can, in such areas, people can be aware of it? How can they see that they are going to the right place and their kids are getting the right medicine?
The thing has to be regulated because it is the job of the government or the state medical council to ensure that there are no unqualified practitioners in that particular village or particular state. So, and the person, suppose it is a remote place in which the doctors are very much less
Rare doctors,
rare
very less
doctors are there.
doctors are there.
So at least government should ensure that there are some, at least in remote area there should be some qualified doctors registered with the state medical council, or there should be some primary health center or community health center in which the person, if the person is going there, so it is at least he is sure that he's going to a right place with a qualified doctor.
Right, right. There has been a debate about whether doctors should prescribe medications using generic names or brand names. What your stand on this issue, and do you think that recent MCI notification will have any impact on prescription practices?
Because it is a generic versus branded medicine issue is there, in which the IMC regulation 2002 also there, and these NMC regulation 2023, which are kept in abeyance. Also, there was issue that doctor should prescribe only the generic medicine, but it has not been implemented. So, as doctor, we want the drug should be genuine one, because if the government issues a notification banning branded medicines, we welcome that. But the generic medicine should be pure. The quality of the generic medicine should be better so that there is no harm to the patients. Because as a doctor, our first aim is to see to it that the patients are being treated and cured at a right time.
Right. Thank you, Dr. Girish. This was Girish Tyagi. Thank you.